Good evening, and thank you for joining us for this evening's Community Leader Call on COVID-19. My name is Tomas Talmonte, and I'm the Deputy Chief of Staff for Mayor Muriel Bowser, and we want to thank you all for joining us. Again, I want to remind everyone for the most up-to-date information and resources related to the response and recovery efforts on COVID-19 in the District of Columbia, please visit coronavirus.dc.gov. Without further ado, I'm going to pass it to Mayor Bowser. Mayor?
Thank you, Tomas, and thank you for everyone joining us. I want to give a quick update and then make time for your questions. I'm joined today by Director Chris Rodriguez from HCEMA and Dr. LaQuandra Nesbitt from DOH, along with Tomas, who is my Deputy Chief of Staff. Earlier today, we reported 99 new cases in the district, bringing our total cases to just over 6,500. And sadly, we also had to report 14 deaths, bringing the number of Washingtonians who have succumbed to this virus to 350. We, of course, keep those families in our thoughts and prayers as we continue to fight this virus. And while we are making significant progress based on the data and metrics that we are following closely, we are not ready to begin a phased reopening of the district. This morning, I announced that we are extending the district stay-at-home order through Monday, June the 8th. But do keep in mind that based on the data, I can revise this order at any time to reflect that we are able to begin a phased reopening. So we will continue to watch every day if the numbers meet our requirements for a phased reopening. The main thing we need to do, however, is for each of us to play our role in reducing the spread of the virus. That means we need people who feel sick to get tested. We need people who test positive to properly isolate, even from their own family members. And we need those who aren't sick to stay at home as much as possible and to wear masks out in public. I also want to remind everyone of the free resources we're providing. Free testing is available at sites across the district, and residents can reach our testing hotline by calling 855-363-0333. If someone has tested positive but needs a place to isolate because they can't do so safely at home, the number to call is 888-349-8323. I want you to know that the sacrifices you continue to make are saving lives, and together by staying home a little longer, we will not only be able to reopen, but to stay open. We know that if we move too quickly, we could set ourselves back, and while we are certainly all eager to reopen our economy, get people back to work, kids back to school, we don't want to do anything that jeopardizes that progress. So again, thank you everyone who is helping us to get through this, and I'm happy to hear your feedback and answer questions. I will have to take off in about 10 minutes, but I wanted to stay on the line to hear any questions in that time.
Thank you, Mayor. We're going to hear shortly from Dr. Nesbitt, and then we'll go into questions. I do want to remind everyone now to get into our question queue so we can try to take some questions as quickly as possible, to press 0 now, and you'll be entered into the question queue. Again, that is press 0. And we will add you to our question queue, and we'll take questions after we hear real quick from Dr. Nesbitt. Dr. Nesbitt.
Thank you so much, Tomas, and thank you, Mayor Bowser, for your continued leadership and support during this time. I'd just like to expand a little bit and to share an update on the District of Columbia's work to expand our disease surveillance and investigation efforts, more commonly known as the Contact Trace Force. The primary purpose of the Trace Force is to support D.C. Health's critical operations to contain the spread of the novel coronavirus 2019 or COVID-19 in the District of Columbia and to prevent hospitalizations and deaths. This will be achieved through rapid and robust case identification, case investigation, and contact tracing, as well as safe isolation and quarantine for all district residents. The 4 positions that we're looking to recruit are lead supervisors, case investigations, and contact tracers. The announcement for the positions closed last week on May 6th, and this past Monday we began onboarding, the onboarding process with 20 new staff, approximately 20 new staff, starting, and over the next few weeks we will continue to onboard approximately 130 new employees. As we move towards reopening the city, we will look to increase our number of contact trace force members to be able to contact someone diagnosed with COVID-19 within 1 day of notification to DC Health, and to contact their close contacts within 2 days of when they are identified. Earlier today, during our press conference, the mayor announced the extension of the stay-at-home order until June 8th, and provided an update as to where we are as it relates to the gated criteria for our phased reopening. The 4 gated criteria that we are monitoring help us assess trends in community spread, testing capacity, healthcare system capacity, and public health capacity. We'd be more than happy to elaborate in terms of our status for those of you who were not able to see the press conference this morning, but do not want to further delay in our ability to take questions. It's always a great opportunity for us to remind folks of the importance of social distancing and staying at home as the weather warms up, and reminding you that we only want you to go out for essential items and exercise, that when you are out, you should wear a face mask or face covering and make sure it fits properly. A face mask should fit snug against the face and cover both the mouth and the nose to reduce your exposure to the virus. And if you don't have to go out, stay home and continue to take preventive measures by avoiding close contact with people who are sick, washing your hands often with soap and water for at least 20 seconds, using an alcohol-based hand sanitizer if soap and water are not available. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. And then clean and disinfect frequently touched objects and surfaces. And so we look forward to our conversation with you all today, and encourage you to visit coronavirus.dc.gov for the most updated information related to our response.
Thank you, Dr. Nesbitt. We will now go to questions. So again, if you have a question, you can press 0 now to be entered into our queue. We're going to go first to Mr. Henry Juarez. Henry, your line is unmuted.
Hi, how are you? My question is, I'm a pastor here in Washington. My question is, based on the new dateline, what will be the protocol, if it's one, for gatherings more than 10 people, if they're going to be allowed after the dateline?
Well, thank you for that question. And next week we plan to get recommendations from our reopening committee about how we reopen across 11 sectors. And the Department of Health will continue to advise me on all of the restrictions. And none of the planning that we've done so far do we think we will be able to lift the 10-person gathering restriction in the early stages of reopening. As we go in to the second stage and third stage, we begin to think about large gatherings.
Okay. Thank you.
Thank you. We'll go next to Angelina Murray. Angelina Murray in Ward 4, your line is unmuted.
Hi, yes, my name is Angelina. I'm in Ward 4. And first and foremost, I want to thank the mayor and her staff for their excellent job of taking care of the Washingtonians. And my question is, I live in Brightwood, and it seemed like we have a whole lot of cases here in Ward 4. And I'm just trying to figure out, is it just blacks, or is it everybody in Ward 4 that is affected by this? Is it a certain age, or what's really going on?
Thank you for that question, Angelina. And last week sometime we did issue our data by neighborhood, and we think that we see we see some things to call out from that data. And you are right that Brightwood and Columbia Heights and some neighborhoods adjacent to Brightwood and Columbia Heights have a lot of cases. And we think there are a few things at play. We think that there may be a lot of essential workers who live in those communities. There is a lot of more dense housing so more people are living in the same area, and there may also be larger, family sizes or people who are roommates or who are living together as well. We also recognize that there is a lot of in-person use of the commercial facilities in Brightwood and in Columbia Heights. So people not getting deliveries but actually going to the store. So it's a lot of commerce there. We are focused, as you know, on outreach to African Americans, particularly who are essential workers and may have underlying health conditions. So we will be doing some outreach and public education around making sure people are getting tested. We are also concerned about our Latino community in those neighborhoods, again, who are essential workers, who haven't been staying at home, not able to telework because their jobs require them to go to work because they are essential. And we want to make sure that people who fall into that category are getting in to get tested. We're also very concerned that people, once they are tested, will be able to isolate from their family members who they live with or their housemates who they live with. And so we're offering some housing assistance to be able to do that.
Great. Next, we're going to go to Juanita in Ward 6. Juanita, your line is unmuted.
Hi, good afternoon. Since we have, Madam Mayor, since you've extended the stay-at-home until June the 8th, will you be reviewing the dates that we have scheduled for the primary, which is May 22nd through June the 8th, taking into consideration that probably some of our most risk people in our most risk groups will not be the people that will vote by mail?
Well, I don't know that I necessarily agree with that statement, Juanita. So let me just step back a little bit. We have expanded vote by mail. The Board of Elections this week has sent out postcard reminders as well as a mail-in ballot request form that you simply need to drop in the mail so that you can vote safely at home. So there's still time to do that. I think everybody has until May the 26th to request their mail-in ballot. And when you receive that ballot, you have until June 2nd to vote at home and send it in. Additionally, and let me just clarify something about the stay-at-home order. There are exceptions to the stay-at-home order. Those of us who do government work, there are a list of essential businesses that, like grocery stores and pharmacies, that are exempted from the stay-at-home order. An additional essential activity is voting and participating in voting. So volunteers who are working at the precincts or people going to vote, that is considered an essential activity, just like going to your essential job. So going out to vote is an acceptable essential activity exempted from the stay-at-home order. Let me be clear about that. But also, there are 20 different vote centers all across the city where people can go and vote. You don't have to wait till June 2nd, which is Election Day, and we encourage you to think about all of the other days before that, beginning next Friday, May the 22nd, when if you don't want to vote by mail, you may vote in person at those 20 vote centers. No matter where you live, you can vote at any of the 20 vote centers. But let me make a distinction. Your neighborhood precinct where you're accustomed to voting on Election Day will not be open. So you will have to familiarize yourself with those 20 vote centers and vote at one of them. But you can do it for the whole period of early voting beginning May 22nd through June the 2nd. So there are many days that you can vote at any of the 20 early vote centers.
Thank you, Mayor. We're going to go next to Margaret Carter in Ward 5. Margaret, your line is unmuted.
Hello, my name is Margaret Carter, and I am in Ward 5. I'm calling in reference to, first of all, let me tell the mayor that she's doing an excellent job with COVID-19, her and her committee. Is there anything else? What I'm calling about is I'd like to know, is there anything being done about maybe the environment? Since this stuff sticks to the streets and sticks to everything, I was wondering if there's anything like maybe washing down the streets at night before we open up on June 8th?
Well, let me just say this. Margaret, was it?
Yes,
We are thank you for that question, and we're going to certainly consider every type of way to sanitize and disinfect. And I've asked my team in particular, where we started is our government buildings, so that there is a protocol for cleaning of the government buildings, that we are going to design sanitation stations for the time when our employees are reporting back to their workplaces that are very clear for everybody to see. Metro is also looking at amped up, if you will, cleaning protocols for Metro buses and Metro rail. And I will also ask them about their bus shelter facilities to make sure that they're part of that increased protocol. We, of course, do street cleaning already on major corridors, and I will actually ask our DPW team to think about other corridors that could be added.
Great. We're going to go next to Shirley in Ward 6. Shirley, your line is unmuted.
Hi, Shirley.
Hi. Yes, first of all, Madam Mayor, let me thank you as a D.C. Resident and D.C. employee because you are really, really making us proud. It is obvious that you care about people who live in this city and you care about your employees, and you have done a wonderful job. So
Thank you.
I could piggyback on what the other lady said. But what I wanted you to know, Mayor, is that some people have called their providers to see if they could get tests because they thought they had symptoms. They knew they had some of the symptoms, and they were denied, and the doctors are not cooperating and saying, well, yeah, you can come in and get a test. So I just wanted you to know that. And the other question I had was, I don't know if the task force has gotten far enough along to talk about what we would do when we go back into the offices, but are they going to, I guess, would they test people if we hadn't been tested before we go back into an office, especially where there are a lot of us?
Okay, thank you for that question. And we are certainly thinking about all the protocols for how people can return to work. And I'm going to ask Dr. Nesbitt to speak to that a little bit while I excuse myself for another engagement.
Thank you so much for the question. We've spent quite a bit of time in the past 2 weeks working with the healthcare provider community to decrease the likelihood that you will have the experience that you had currently and that others will have that same experience. We've surveyed all of our provider community. We're working with a large group to help them increase the amount of testing that they're doing, and I'm proud to report that we've seen some of those providers going from offering 50 tests per day just 2 weeks ago to 150 tests per day this week, and we're being able to address some of the barriers that the small private physicians are experiencing so that more of them will be able to accommodate their patients for testing. Our future state suggests that we should not only have mass testing sites in the district where individuals can call our hotline and get a test, but that they should also be able to rely on the ability to call their personal physicians and be tested as well when they have concerns for signs and symptoms. In terms of requiring people to have a test to return to work, that is not best practice. What we should have the ability to do is that if individuals have signs and symptoms of COVID-19 or have had a close contact exposure either at home or in the workplace, we do have the capacity to offer those individuals a test. And we'll be able to do that as more people return to the workplace, not only in the District of Columbia's government agencies, but in all businesses. And those are discussions that are currently underway in the Reopen DC Advisory Group, and you can expect to see very concrete recommendations coming forward next week, as the mayor has described.
Thank you, Dr. Nesbitt. We have time for just a few more questions, but do want to remind everyone we have this call every week, Wednesday at 5, same number. So if we don't have time for one of your questions, we have this call weekly, and we hope you'll join us, and we hopefully will have time to answer your questions next call if we didn't get to it today. We're going to go next to Betsy Fisher in Ward 2. Betsy, your line is unmuted.
Hello. Thank you very much for taking my call. I own a small business here in Washington, D.C., and I do follow the news closely. I know that we've had 350 deaths in a population of 720,000 here in D.C., which is 0.0000014%. And I'm completely concerned that the fact that we're using the number of cases as a measure of whether we should reopen or not really doesn't deal with the fact that the mortality rate is not, it sounds so cruel to say this, but the mortality rate or the per capita number of deaths don't seem to match the extreme economic dislocation this is causing. And it's an incredibly regressive measure to keep businesses shut down, hurting small business owners and the poor especially, without harming at all people in government who are getting their full salaries. And I am just distraught that the measures do not seem to match the severity of the infection.
So thank you for your question. The case fatality rate in the District of Columbia currently for COVID-19 is just over 5%. For certain groups, it is much higher. So for individuals in congregate settings, such as our long-term care facilities specifically, it's over 21%. And for individuals who are not associated with the risk group, it is 0.03. So we want to make sure that we're talking about the right statistics as opposed to calculating a case fatality rate for the district. That will be applied to the total population. Case fatality rate should only be calculated for individuals who have actually had the infection. In terms of the metrics that we are using, these are agreed upon metrics in the public health community and are also consistent with the White House's plan for reopening America. So expecting to see a decline in new cases for 2 weeks is an agreed upon public health principle and a gated criteria. Expecting to see that decline for 14 days is consistent with the incubation period for the virus. You should also note, as we discussed earlier this morning, is that we are looking at not only the cases, a decline in the cases that we report publicly, which would be the number that we report on the day that we receive the report as a health department, but we're looking at it more closely as it relates to symptom onset, as well as noticing trends in the decline of community spread, which allows us to not take into consideration every single case that occurs in our community, and we can eliminate an accounting for cases that occur in congregate settings where those individuals have a decreased risk of transmitting the virus in the community. So I think it's critically important that people understand how to look at the case fatality rate for the virus in the proper context and recognize that the metrics that we are using for understanding if the virus is contained in the district and the national capital region is how we're making decisions about whether or not is it appropriate to transition into our phased reopening.
Thank you, Dr. Nesbitt. We're going to go to our final question from Angela Terry in Ward 7. Angela, your line is unmuted.
Hi, everybody. I want to say you guys are doing a great job. I truly appreciate this call. I do want to have two questions. Actually, I did not know you did weekly press conference. I was happy to get an email to tell me about this call, and I live in the district, and I didn't know what was going on, so I am grateful for this. So my first question is, are the press conference weekly? And my second question is, are we testing the water supply at all to see whether or not we have live traces of the virus in our water supply?
Angela, thank you for both questions. I will take the first one, and I'll let Dr. Nesbitt take the second part of your question. Yes, we are doing several levels of engagement with residents across the District of Columbia, and so I am very happy that you got the notification for today's call and joined us. Our goal is to each week to get the message out as much as possible about this weekly call. We've had this call every week since the beginning of the public health emergency to ensure that we are getting information out as much as possible. So the number stays the same every week, so I hope you will share it with your family, friends, everyone you know. If you have a Twitter account, we hope you tweet it as well. The mayor also, we have this call weekly, but we've also done calls with different constituencies throughout the public health emergency. So we've had calls targeted at our seniors. We've had calls targeted with the Latino community, and so we'll continue to do in Spanish language calls. And we've also done robo-dials. Hopefully you all got a nice call from our former First Lady Michelle Obama reminding you about testing resources in the District of Columbia. And we've done calls with our council members in various wards to also share information, robo-dial calls with our council members to share information on testing. So we are going to continue through the length of the public health emergency to have these calls, this one weekly at 5 on Wednesdays, but the mayor also is doing press briefings, which have been about 4 days a week, Monday, Wednesday, Thursday, and Friday at 11 a.m., sometimes at shifts, but you can, coronavirus.dc.gov, we have all of our most up-to-date information, including the mayor's briefings, press briefings, and any of the presentation materials from that day of press briefing is also posted there as well. So I'll go to Dr. Nesbitt for the second part of your question, and then we'll go from there.
Yeah, so thank you for the question about the use of a diverse set of surveillance metrics to understand how the virus may be present in the community. The use of wastewater testing to detect the presence of a number of things, including, for example, we've explored the use of wastewater testing to detect the use of opioids in our population. And even yesterday during the congressional hearing, Admiral Giroir mentioned the potential for wastewater testing to be used to determine how much virus may be present. I think it was one of his responses related to university campuses or dorms. We have assessed whether or not that would be a useful tool in the district, and while the science on it is not exact yet for the presence of SARS-CoV-2 in the district, we have not yet added it as a surveillance tool, but look to continue to follow the science on it as an added surveillance component.
Thank you, Dr. Nesbitt. So again, we want to thank everybody for joining us on the line. Again, we'll be back here next Wednesday at 5 o'clock, and we hope you'll join us, same number. We want to remind everyone one last time, for the most up-to-date information and resources, please visit coronavirus.dc.gov. And I just want to say, I always try to close this call with gratitude, and I want to just say thank you to everyone on the line and to all of our residents for doing their part to stay home. We are in an extended order through June 8th to stay home and only leave our homes for essential activities, as the mayor highlighted. But each of us continuing to do our part will ensure that we can begin a phased approach to reopening, but it'll also save lives. It saves the lives of our neighbors, our fellow Washingtonians in all 8 wards. So I just want to thank you for staying home, continuing to stay home, and doing your part to help us flatten the curve. And one last time, coronavirus.dc.gov. Thank you so much. We'll talk to you next week.